I am one of 8 children, and I started playing a lot of golf with my mom and dad because it was the time that I had with them without a lot of others. So it gave me the special attention.
Not to mention that it's one of the first activities we did together.
Oh, that's true too. Yeah, yeah, we would play golf.
Yes, we play golf.
My name is Karen Maier. In 2020, I had a lung CT. As a result of that CT, that they noticed a nodule on my upper lung right up in here. No symptoms, no other issues, never even had an idea that that might be there. The doctor that I was going to at the time, I said, where do I go, what do I do? She said, you have choices. And she named University of Cincinnati. I made an appointment and saw Dr. Sandra Starnes, the head of thoracic surgery. She agreed to do the surgery. As a result of that, they took out the upper right lobe and some lymph nodes to determine it was stage 1. So I'm very fortunate when they had diagnosed me with lung cancer that when I woke up from the surgery, I was cancer-free.
Lung cancer is the #1 cancer killer in the United States in both men and women. It far surpasses the other top 3 cancers combined. And it's been like that for decades. One of the reasons is that 75% of patients are diagnosed at an advanced or metastatic stage, meaning it's spread. And the cure rates are much, much lower, usually less than 20%. With lung cancer screening, 75% of cancers are actually detected at an early stage when cure rates can be over 80%. So it can really flip things.
Smoking is definitely a risk factor, but that's not the only reason people get lung cancer. Lung cancer by itself does not cause symptoms until the patient is in a late stage. So with lung cancer screening, what happens is that we can discover these cancers which are asymptomatic, meaning they're not causing the patient any problem much earlier, where there is a very high chance of complete recovery.
Karen is a woman who took the step to get a lung cancer screening, which again, not everybody does. And fortunately, we were able to detect an early lung cancer, and she was treated successfully and has done well.
Emotionally, I was probably a little more of a wreck, but I will say we found out so early that we felt pretty comfortable that it was something that could be rectified. We were together through that, and it made sense, and it became a lot less scary.
When you have got doctors that will take the time, like Dr. Starnes, to talk to you, that's what makes the difference. I just knew that I could trust her to take good care of me. She really cared, and she still does. It's not just medical care, it's mental care. It's this kind of care of, are you okay? Do you need anything? Can I get you anything? She stopped in several times a day to make sure I was doing okay, that I was healing well. The people are just fabulous.
The advances that we've been able to make over the last decades, like in novel therapies and new surgical techniques, a lot of that's been funded through philanthropy. When you're putting money in, it's getting used thoughtfully, not just from one person, but from a whole group of experts. We're really looking at what is the best use of these funds to really bring cancer care forward.
Dr. Starnes and I were talking about how if more people were able to get a CT scan, like I did, they could be diagnosed earlier. And so I said, how do you reach out to those people?
So I think the biggest barriers to screening is, even though it's been around for a decade, it's still a lot newer than other screening tests. So I think there is just a lack of awareness. And I think some of it too is access. So some patients may live out in a community where they might not have access to a screening program. I think it's a combination of a lot of things.
Makes me feel good to think I can do something for somebody else. It might be something as simple as being an advocate. That to me makes a difference. It takes a passion and a desire to make a difference, to make a change. Anybody could do that.